Hello, everyone, and thank you for attending today's webinar, Supply Chains That Save Lives, How Embrace Global Delivers in Crisis Zones. My name is Thea Dolan, and I'm the director of Flexport.org, which is Flexport's social impact arm, focusing on transportation for nonprofit and humanitarian cargo. We have an exciting conversation ahead of us, but a few housekeeping notes to kick things off. On your screen, you should see a sidebar to the right of the main stage where you can submit questions. And at the end of the presentation, we'll save some time for Q&A, so be sure to get those in. And in that same sidebar, you'll see a tab titled Docs, where you can find more information about Embrace Global and Flexport.org. Now, a brief legal note, please keep in mind that the information provided in our upcoming conversation is for general informational purposes only and might not be suited to your particular business requirement. All right, joining me today is Melody Westen, the CEO of Embrace Global. Melody stepped into the role in January 2025, bringing with her 20 years of experience in nonprofit leadership, development, and strategic planning. Before Embrace, she was the executive director of Akashinga, an international NGO focused on female-led conservation efforts in Africa. She's also held positions at the International Rescue Committee and Back on My Feet, where she led initiatives to empower communities and create real impact. Melody is known for building sustainable infrastructure, expanding funding opportunities, and making sure that organizations tell their story in a clear, powerful way. Welcome, Melody. So excited to have you here this morning.
Thank you so much, Thea. I'm so excited to be here.
Wonderful. We can jump right into it. So I'd love to open up our conversation by asking you to share a bit more about Embrace and your organization's mission.
Of course, of course. So just to kind of set the stage, every year there's around 13 million babies who are born premature. And every 40 seconds, one of those babies dies. And in most cases, that is entirely preventable. What they lack is something very simple. It's just warmth. So at Embrace Global, we believe that every baby should have the chance to survive and thrive. So we've developed innovative solutions to protect vulnerable newborns in places where resources are scarce. So since 2012, we've deployed our portable, reusable incubators across low resource settings and humanitarian emergencies. Our device, which I do have one here with me, only needs occasional power, so it even works when electricity is unreliable. And unlike traditional incubators, it's simple to use, it's easy to clean, and it's durable for the most rugged conditions. So each one of our devices can be used hundreds of times, creating years of life-saving impact. Thus far, we've reached over 1 million babies in over 25 countries around the world.
Wow, that's incredible. And what countries are you guys delivering into?
Sure. We are in currently where we've been deploying recently to DRC, Sudan, Yemen, Syria. We've been in Ukraine, Gaza, and parts of in India where we were first developed. I mean, the list is quite extensive.
Yeah, that sounds like a very broad set of geographic areas. Is that dictated by need or specific crises that you guys are responding to?
So we focus on countries and regions that have high neonatal mortality rates and where there's a gap in neonatal care, and then also with emergency response, disaster relief, we'll go where the need is. So in those sorts of scenarios, we might be in places that traditionally might have had access to neonatal care, and now, given the conflict, they do not. So, but typically, the areas where we see that equity issue with access tends to be in South Asia and Sub-Saharan Africa.
Interesting. And I read about the story of how the incubator was developed by Stanford students in 2007. I thought that was so interesting. Is that kind of story common in the humanitarian space, new product development, or is that unique to Embrace?
I mean, there's a couple, but I do think that Embrace is very unique in the way that our product came to be. I mean, as you mentioned, it was for Stanford business school students, and utilizing design thinking, they moved after their class. They moved to India for 5 years and really took a human-centric approach to the design of our device. I mean, we could spend a whole hour on just the tiny little intentional design pieces to make this as thoughtful and accessible for rural hospitals, community midwives, transport, and the use cases. I mean, they really worked hand in hand with health workers and the people who we want to be using this device to make sure it is effective in these sorts of settings.
Yeah. And I was wondering, who and what organizations are you all delivering to in country?
So we have quite the breadth of partners. For a lot of our emergency response work, we tend to work with larger partners. So International Medical Corps, CARE, Project Hope. We've worked with different UN agencies. And then on the local or strengthening local health system side, we work with a lot of local partners who have community health workers, community midwives. So we've done a lot of work in Zambia with Newborn Support Zambia. We just we'll do a formal announcement next week, but we've just launched with For Mom and Baby Foundation, working in Cameroon, and we've just sent 60 of our devices there, and it's a team of midwives, community midwives, working in and around the conflict areas in the country. So it really depends on the need and partners who can really help with that last mile delivery and implementation.
Yeah, absolutely. Congratulations on the partnership in Cameroon. Super exciting. And yeah, I'm interested to know what the vetting process looks like for those new partners. Obviously, having the right partners on the ground for that last mile of delivery, like you mentioned, is one of the most critical parts of the process. So what does that look like for you?
So we have a pretty rigorous vetting process in place. First, making sure that there is the appropriate need in the country, and that this partner has been there or is able to have the infrastructure to deploy. Looking at different ways of being able to get can we actually work in the country? Is there the correct approvals for our medical device? We are CE marked, which does help because it is very widely accepted, but we do need to go through that and make sure the partner can help with that. And then just we look at our partners as long-term partners. We're in it for the long haul. We provide continued training, as well as any replacements, or in some cases, as our partners expand, we want to grow with them. So we're really looking for those partners who understand that and want to be involved with Embrace in the long run.
Yeah, building those long-term partnerships must just pay off, right? Way less sort of thrash around getting your supplies on the ground. Flexport.org, we also support from a supply chain lens. So we do vetting of consignees and recipients, making sure that they have the right licenses in place, because delays once a shipment arrive is a painful process for everyone.
And it needs to be, we have to rely on the partners. We rely on our logistic partners, our on-the-ground partners, and having that networked approach really will allow us to be able to get to where the need is. And when you're thinking about a premature newborn dies every 40 seconds, every minute is a life that we could have potentially helped save.
Yeah, absolutely. Now, you showed us a little bit what the incubator looks like. They are really small, very cute, compact. So it seems like it must be a really cost-effective way to get help to babies in need. Is that right?
It is. So when you think about a traditional incubator or infant warmer, you're thinking about, if everyone on this call is picturing what a traditional infant warmer incubator, it's quite a large piece of machinery, and they're also very expensive. So let's just say around $20,000 each. They require stable electricity, trained staff. And so for that same $20,000, we can provide 40 of our lightweight, compact devices. So not only does that keep shipping and customs costs down, which when we're dealing with humanitarian logistics is critical, these devices also only require 30 minutes of electricity. And then they provide 4 to 6 hours of warmth. So that electricity draws about the same as a light bulb. So you can run it off a generator, off of solar. So it makes them ideal for conflict zones, rural hospitals. And when you think about sending 40 versus 1, that 40 can help save nearly 2,000 babies in its first year alone. And because they're reusable for years, it's a cumulative impact. So we can really multiply that impact and reach as many babies as possible. So
yeah, the impact per dollar spent seems like an incredible payoff. It's amazing.
Exactly. Yeah.
And I think we have folks joining us from both the humanitarian side of the house and the commercial side. And I think everyone in logistics understands having to work with a lean team. So I wanted to learn a little bit more about your organization and how you manage a global supply chain and procurement process with a small group of people.
So I think in some cases, less can be more. We do run a very, very lean, but a very efficient operation. And it took a few years for us to get here. And also it took us, technology as well, getting to where it is in 2025. So to start with, all of our incubators are manufactured by our partner, Phoenix Medical Systems in India. They're fantastic. They meet international quality and safety standards. They are a broader neonatal manufacturing company. So they have that credibility and they have that manufacturing in place. From there, our team will manage the global logistics, but collaboration is one of our core values at Embrace, so you'll hear me say it a lot. But we couldn't do that without support from partners, many times Flexport, to make sure that the incubators are arriving quickly, and even some of the toughest crisis zones in the world. And then we also are focused on automating whenever we can. I love all the AI agents that are coming out. I think there's a lot of opportunity there for small teams. And then tools like the Flexport customer portal, and they didn't tell me to say this, everyone, but that portal it has been such a huge help. I mean, and I personally really appreciated all the training tools you provided to us so we can navigate it. But those sorts of tools where we can see that tracking in real time, where we can work with our partners in real time is critical. And then on the ground with having those vetting processes in place for our partnerships, we rely on that growing network of partners and the local organizations for that last mile delivery and training. So it is a whole process, but when you work through partners and you have that trusted partnership and you're approaching these things with a true, authentic spirit of collaboration, like we can only do this together. We can't do this alone.
Yeah, absolutely. We always say at Flexport, we want to be an extension of our customers' supply chain teams and, make it easier for them to operate with less. And building a long-term partnership and growing together, I think, is a really effective way to do that. Cost saving for everyone, time saving.
Definitely. And I even think too, I know we're probably going to talk about flexport.org soon, but one of the things that I always kind of reflect on with you folks and the grants that we've been able to receive is at certain times we might not have been able to receive it, but one of our deployment partners had a grant and they used it. And just this sort of, and I think we're seeing it across the sector now, this sort of very just ruthless collaboration when we need to get the job done is, I think it's like the silver lining of our times. And something that will help us to be able to surpass and weather the storms in front of us.
Yeah, absolutely. And it's such a small world in this space. There's so many partners that you work with, that we work with in other capacities, and taking kind of all of the knowledge that we have, applying it to each shipment every time, I think is a great way to your point, maximize what we do have in a very resource constrained environment, without a doubt. So yeah, let's talk a little bit about Flexport. What has the partnership been? We started working together, I think, in 2022. Side, what's made it a success?
I mean, I think it was 2022. You helped us to get thousands of our devices into Ukraine, and since then, I mean, we've helped some of the hardest to reach places in the world. Whether it was Gaza, we were helped to get into Syria, and not only the in-kind shipping, which is huge for a small organ. I mean, we are small. We have a very small budget, so every dollar counts. But the logistical expertise, I mean, just recently we've had a very large request go out for Sudan, and we're shipping it in 3 different shipments. And you not only were able to help us with a grant to cover the shipping to get 300 of these devices to Sudan, but when there was an issue with one of the ports I went to sleep and I woke up and it was solved, and you were able to help work with us to make sure it didn't go through that city anymore, and we rerouted it quickly. I mean, I was so impressed. And I think that's what makes this partnership so effective, is that you're able to navigate these complex systems and like we couldn't do that on our small team, but you bring that expertise to the table on the access to customs process. And you also understand the urgency of neonatal care. Like I do feel, working with the folks at Flexport, all of you understand that 40-second number, and that you treat every shipment as if it were your own, and that's the kind of work and collaboration that this Life-Saving Works requires. And I love that together we're getting to help save babies.
Yeah, your team is a pleasure to work with. So the feeling is very mutual, and we're also just so passionate about the impact that your product has. So it's been a pleasure for the past 3 years. Looking forward to many more, for sure.
I really mean it. Thank you so much.
Yeah, truly a pleasure. And now I know you have ambitious goals to reach more babies in need. So I'd love to hear a little bit more about what that looks like for you, what your goals and timeline are, and we can chat through it.
Sure. So this year we reached a very exciting milestone of helping to save 1 million babies. But as I mentioned, 13 million are born premature every year, and 9 million of those are born in South Asia and Sub-Saharan Africa. So we have our work cut out for us. Those are the areas where newborn deaths are the most concentrated, and also where incubator access is the most limited. So our long-term goal in the next 10 years is to reach at least half of that, those babies, which, 4.5, 5 million would probably be good coverage. A lot of those babies are born in hospitals that have great neonatal health care. Right now we're mapping that out, but our first big benchmark is to reach 1 million babies annually. And we think we can do this by the end of the decade. It means aligning our funding, production, and distribution strategies, which we've been working on this year, and we have the plan in place. So to do that, a couple of things. I mean, we need flexible and quick logistical support, but we have the manufacturing in place. We have the logistical support in place, and we are going to be creating an emergency response fund. So when these emergencies arise, we're not trying to backflow the fundraising. That has been something that has held us up. I'm sure other organizations who work in the emergency response space can empathize with that. So we're looking at more sustainable funding sources who will contribute to an emergency response fund. So that way, when these crises escalate quickly, we can respond, because all the other pieces are in place now. And then we're also focusing on automating whenever possible, so we can keep the pace with that, with the urgency. And we have Embrace moving from a nonprofit to a for-profit was the best thing that could have ever happened to Embrace, because now we can really address the equity issue that our founders started this organization for. And we're just getting the partnerships. We have the partnerships and the support in place to be able to do that.
Amazing. To that point, how can folks on the call get involved in Embrace's mission and work?
Well, visit our website. Please learn more about us. We are looking for partners, whether it's deployment partners to help get our device into the hands of the frontline health workers who can use it. Corporate partners, we're looking for corporate partners who might want to support us. Obviously, always donations are very helpful, but we need to get the word out there. So following us on socials, we're on LinkedIn, Instagram, all of them, and letting people know. I mean, an introduction is is one of the best gifts people can give. And there's a lot of people who just don't know about our work. And if they did, they might be able to help us as well.
Got it. And I just wanted to jump back to the our previous question about your guys' shift. I think the shift was from a profit to nonprofit. Is that right?
Yes.
And could you tell me a little bit more about the whole journey to make that happen?
Sure. So Embrace started out with the intention of being a nonprofit. But it was the times, and there were a lot of investors for that for-profit social enterprise. It was 2010, 2011. And so it moved into a for-profit model in 2012. They did try a hybrid and it didn't work. And so they stayed as a for-profit, but they were never able to scale. And I think it was a matter of being the approach in the for-profit is if you wanted to scale, you had to sell to ministries, and you didn't have that in-country buy-in. And so with our switch to a nonprofit, we work on donations. And so we can work with the larger organizations to reach the masses, especially in emergency response. But we're really looking also at building out that local health system strengthening piece and working with local leaders. So they have access to this technology. They have the capacity building to be able to provide this sort of care. And ideally, our scale, it is our scaling strategy, is we will have a cohort of in-country ambassadors who are familiar with our device, have used it, and that's where we'll really see that local, national, and hopefully one day regional impact on neonatal mortality rates.
Super interesting. And right now, what does your in-country training look like? I know you mentioned you all do training to make sure folks understand the how to use the incubator. Is any of that in person today or all remote?
It's all remote and it's different depending. Our ideal is that we are able to do multiple trainings over Zoom. But in some cases, that flexibility, we've had to put our training on a USB and it is sent around. I think you guys might have remembered been a part of a few of those. So it's really meeting our partners wherever they're at. And then in the long haul, especially as emergencies and conflicts may shift, whether we're there for that long haul on rebuilding as well. We sent hundreds of incubators to Syria this year, and they went across the whole country, and we all reflected on the fact that we're helping to rebuild a country's medical and health infrastructure that was fantastic prior to the war.
Right. So interesting to hear about the current state and the long-term vision. We have a few minutes left here, so we'll take some time to answer some audience questions. A reminder, you can submit questions in the Q&A tab on the right of your screen, and we'll also open up the feedback survey. So take a moment and complete that so that we can continue to curate great content for you. But my first question is going to be for you, Melody. I think most of these will be. What lessons from your time at Embrace so far do you think are transferable to folks on the commercial side of the supply chain?
Lean teams can run highly complex global supply chains, but through strong partnerships and technology. I think that's a big one is, you can be small and mighty. You don't have to have a huge operating arm. Other lessons that we've learned that I think would be transferable, flexibility matters. Supply chains need to be able to adapt. I mentioned Sudan again and being able to pivot on a moment's notice. So flexibility is key. And then pre-positioning inventory is where we're working to get to through the emergency response fund. But having those sorts of inventory stores on hand helps to reduce deployment time. And for us, and I'm sure some of your commercial clients on here, speed is life-saving. So that's key. And then I think local partnerships. I'll always sing the collaboration song because it is so critical to everything. But that last mile delivery is impossible if you don't have trusted in-country actors to help with that. And not only do you have to have them, like we need to support them. And we need to make sure that they have what they need to have that capacity to be able to do their work.
Yeah, absolutely. And so we have one question in here as well, asking about how you all prepare and respond to risks. I think you touched on that a little bit through your focus on building your emergency fund and the goal to pre-position cargo. What are your plans related to pre-positioning, if you can share them, that you're hoping to build toward?
So I think we did touch on quite a bit of them. The pre-positioning inventory is key. The collaboration, being able to collaborate with different partners along the way. Because if you have those relationships and something goes wrong, everyone is willing to give each other a little bit more grace and come to the table in the spirit of problem solving. And fostering that trust is just so critical. Maintaining the strong manufacturing relationships and diversifying manufacturing if possible to help maintain that quality and reliability. And then as best you can anticipate. We can start to see when things are about to happen, and as much as we can front load our work, we look at it as being prepared is a core strategy for us. It's just the nature of what we do. So it can't be something that we're like, oh, we should have done that. I mean, and again, these are all lessons, hard-won lessons, but so really easy to say this after, Embrace being around for more than a decade, or, the team and my, I think we've 60 plus years experience between us. But it is, taking those lessons and making that preparation part of the strategy.
Yeah, without a doubt. Scenario planning, I think, is top of mind for folks on the commercial and humanitarian side. Without a doubt, it's a constantly changing climate that we're operating in right now. So everyone's on their toes.
Always have an A, B, and C.
Absolutely. Wonderful. We have one more question here for you, Melody. And what are the key metrics that you look at when you're monitoring your supply chain to know that it's operating well? I think you mentioned time to deploy.
Mm-hmm. For the supply chain, it's definitely time to deploy from order to in-country arrival, and then cost per incubator delivered, and then on the other end is the time for the last mile incubator delivery. So really, again, time is of the essence in the work that we do. So when everything is operating and working smoothly, we can move quickly with minimal bottlenecks in customs or internal transport. And for us, it's making sure that our incubators are keeping babies warm. And that we are able to make sure that no baby ever has to go without that warmth, no matter where it's born. So
incredible way again to bring us back to the mission. It's so funny that the metrics that you look at are so similar to a commercial supply chain, right? In terms of, are we operating efficiently and well, but the impact is so meaningful. So thank you again for sharing that with us. We're right at time here, so that will wrap up our webinar. A huge thank you to you, Melody. It was a really wonderful conversation this morning. And thank you to everyone for attending. We will email out a link tomorrow morning with a recording to the webinar, so check your email for that. And that will wrap us up. Thank you again. Have a wonderful day.
Thank you so much for having us, and thank you to the whole Flexport team on behalf of everyone at Embrace, Thea.